Welcome to the final episode of this year's Beyond Nurse Residency Podcast. Today, we're doing something really special. As we close out 2024, I'm joined by my incredible team from the Iowa Online Nurse Residency Program to reflect on our journey this year. We'll be sharing our favorite episodes, discussing key takeaways, and looking ahead to what's in store for Season 2 and 2025. It's been an amazing year of growth, learning, and connection, and we can't wait to dive into this conversation with all of you. So sit back, relax, and join us as we celebrate the highlights of this year. Let's get started. So I have with me first today, Jill Gillespie. So I wanted to start with Jill because, first of all, she has been with me the longest, but also Jill is not a nurse. She is not a healthcare clinician. She is our amazing marketing coordinator. So first, Jill, I have to ask, what did you really think when I came to you and said, I think I want to start a podcast and I'm going to need somebody to edit it?
Well, thanks for having me, Nicole. I was excited. I love jumping into things I'm not sure of how to do and figuring them out. So I enjoyed puzzles. So, that's what it is. Just figuring it out one piece at a time, right?
I love that.
Yeah.
I love that. So why don't you start off by telling our listeners just a little bit about yourself, and then we'll jump into the questions that I have for you.
Okay. Well, I'm Jill Gillespie. I'm a graduate of the University of Iowa. I had a bachelor's of arts in communications. And then I went on to get a graphic design degree up in Minnesota. So I have a background in marketing and graphic design. And I have been with the College of Nursing for 5 years now with the Iowa Online Nurse Residency Program.
Well, and we have been so lucky to have you. And I think a lot of our growth the last 5 years, I think, is attributed to the work that you've done. So thank you so much for all that you do for the program and do for this podcast, because it's been really fun diving into this new sort of area of marketing and communication. And I know we couldn't have done it without you.
Oh, thank you. It's been fun.
All right. So, of course, big question as we sort of reflect back on 2024 and starting this podcast, I just have to know, even though you're not a nurse and you're not in healthcare, what was your favorite episode this year?
Okay. So my favorite episode was episode 4 with our guest, Patrick Jeffs, about clinician well-being. And I thought it was such a good episode because it really was things that you could take away even if you aren't a nurse or in the healthcare field.
What were some of the sort of, I guess, key takeaways then from that episode that really spoke to you?
Well, there were quite a few, but I loved when he talked about micro moments. So the idea of well-being can be overwhelming. You think it's just exercise and eating right. And how do we fit another thing into our schedule? But he took it so simple and small, and it was just these micro learning times. So, for example, you're a nurse, you're going into the room to see a patient, and you touch the door handle. And that was like your trigger to say, I need to take a deep breath, or I just need to be present. I need to reset, and I need to take a breath. And then just working those little micro moments throughout your day. So I thought that was very powerful because I find myself doing that working from home, setting alarms to stand, to move, to use my standing desk and not sit for hours at a time. So I really enjoyed that.
I was just going to comment on that. So, I mean, I agree. I think, a lot of times when we're talking about well-being with people or even our new nurses, they're like, yeah, I've heard it all before. I need to eat right. I need to exercise. I need to get my sleep. But I think what he calls attention to is that it's so much, I mean, yes, those things are important. He talked about that those are huge things that we can do every day. But it's really about more than that. And I know we haven't introduced Amanda or Jess yet to the episode, but what did you guys think about that? Did that sort of resonate with you, or how are you seeing that sort of play out with the new grads as we talk about this topic?
Yeah, I think that resonated with both Jess and I know that we've been sharing that example specifically with residents in our live discussions. Oftentimes they say, well, I don't have 15 minutes or 30 minutes to take a break and check in on myself, especially on the busy days at work. So when we help them to incorporate those little things like touching the door handle before you go into the patient room. How are you feeling? And kind of doing that short little check-in, I think, is really helpful for them too.
And I think it's not so much about only at work. We tell the residents these are things that you can also be doing at home. So before you walk in to your house, touching that door handle and taking a breath. I love that episode with Dr. Patrick Jeffs too. I like that he said taking the long way home. And I try to mention that to residents too when they need maybe just a little break from the chaos that's on their unit instead of dropping a lab specimen off at the lab and hurrying right back to get back to patient care, instead taking that longer route to get back to your unit. I think both of those really resonated with me in that episode.
Well, and that's something that I remember when I first met Patrick, we talked about. So obviously I work from home. You all work from home. Taking the long way home from work when you work from home is really hard to do. So, I mean, I remember like the first time we talked together, I was already asking him like, well, what does that mean for me? Because I don't have a very long ways to go. And so he mentioned at that point, thinking about the doorways, like when you walk through a doorway, just kind of maybe you're not touching a door handle or whatever, that could also be a trigger. So I think that was a really important, point that he shared, and obviously very applicable to anyone, whether they're working in a hospital, whether they're working from home or anywhere in between. Any other surprising insights or lessons learned from that episode, Jill, that you'd like to share?
Well, I loved all of the great tips for an individual, but then he kind of delved into the systematic way of integrating resiliency in healthcare. So really looking at it as we're all in this together, where maybe 10, 15, 20 years ago, it was like, that's your problem, that's your mental health, go fix it on your own in isolation. Where now it's like, no, we all have to understand each other and be there to help each other. And so how can we really bring this into healthcare? So I really liked how he just talked about processes and looking how things work in the system and really looking at meetings and what everyone has on their plate and talking about the 60 seconds of silence before the meeting, which is something I know you guys do with the nurse residents, but I have never experienced that. And we did it a couple of times in our Zoom meetings for our Monday meeting. And I had a crazy morning. Things hadn't gone the way they were supposed to. And we just turned our cameras off, muted it, and we took 60 seconds and I just did some deep breathing. And I turned my camera back on and I felt like a different person. So I thought that was so powerful, just to let everyone start from zero, forget everything that had happened building up to that moment. And just talking about how it gives people more empathy. It makes you more focused. Just these little mindful things you can do. So I like how he likes to go into these healthcare systems and see all those different points that we don't even think about.
And I think as a leader, thinking about how can we build this into some of our day-to-day business. So meetings is a great example. And I agree. I really enjoyed when we did that. And, you kind of forget that you did it for a while and then you fell off. So maybe as a team, we need to think about taking that, bringing that back, because I know we meet every Monday morning, and Mondays just in general can be hectic. So I think I see all heads nodding. I know our listeners can't see our heads nodding, but it's like, yeah, maybe that's something we can bring back even to our team to help sort of continue to build our capacity for resilience.
And that's one nice thing about Zoom. I feel like it's more appropriate in a Zoom situation. I don't know if I'd be as comfortable sitting in a room, closing my eyes with a bunch of people, but for some reason you can just turn everything off and really get into a place of focus. I think it's essential for people that are on Zoom.
Well, and a lot of times when you're going back to back to back to back to back, Zooms, or when you have days like that, how valuable that even 60 seconds can be.
I think another good point he made was the more you work on well-being and resiliency, the less you need it. which I think is really interesting. And I think a perfect example is I love to meditate. I try and meditate every morning. Obviously, that doesn't happen. But I've heard people say meditating, you won't notice in the moment as much, but you'll notice the effects of it. And I notice I don't freak out as much. I don't get as anxious. I handle my children better. It just naturally makes you be at a calmer level. And then you're like, wow, that really is working because my reaction was way different, or that didn't bother me as much. So I like that he said that. It's a muscle that you have to work like in a gym, but as you get stronger, your muscle gets better.
Well, and I think I noticed that, when we have those crazy busy days or I work really long hours, because I just don't feel like I have time to take a break. And then when you go to bed, your brain sort of begins to process your day, right? And you're just sitting there and all the thoughts are going through and then you can't fall asleep in it. And I notice it every time that I have a day like that is exactly what happens. And so really, like you said, making sort of that point to use these strategies when you don't think you need them or you don't have time is really when you need them the most.
And I think something to remember too that we share with residents a lot is some strategies might work really well for you. So like meditation works well for Jill, but I know personally meditation isn't always my thing. So I think when it comes to well-being, it's really important to find those little practices that you find effective.
Well, and you don't have to do all of them, right? Because I think at one point it was like, oh, I need to be doing this and this and this. And then it became this checklist that I felt like I had to check off and do all the things because I like to complete my list. A nurse, you got to check off all of the tasks. But, that's really also not how you should treat it. All right. Well, I thought that episode 4 was really, really special. Obviously, lots of great takeaways from Dr. Patrick Jeffs, and I think he's definitely one that we could have additional conversations with down the road. So, all right, let's go next to Amanda. So, Amanda is fairly new to the program still, coming up on year 2 here in December. So, Amanda, why don't you start off? Tell us a little bit about you, sort of your history here with the program, and then we'll hear more about your favorite episode.
Yeah, so as Nicole said, my name is Amanda Bruscher. I have been a nurse for about 8 years now, so I've been in many different roles in that time. And actually, but when I was about a year into my nursing career, I was actually a resident in the IONRP program. So I go way back with the program. I know when I took it, being a year into my nursing practice, I was a little hesitant, wondering if I really needed it. But even being a year into my nursing practice, I got so many great takeaways. And I was working at a rural facility. So I think the resources that the program provides just really helped me in that transition. After that, I've worked in the rural hospital setting. I've worked in oncology, and then I have been in this role, as Nicole said, for almost 2 years already. This role is completely different from anything I've ever done. So it's definitely been a transition and lots of learning, but I think I've grown so much as a nurse leader, educator. It just offers so many unique opportunities. And I've really just loved being able to work with the new nurses, our new grads, and then also our wonderful team as well. So
excellent. Well, Amanda, it's been great. Great to have you on the team. I know you really enjoy sort of that connection time with the new graduates. And I think, with your history of having been through the program and maybe even being a little closer in age to some of those new grads that we have coming out, I think that's just really valuable. So I really appreciate all that you bring to this program as well. So as we sort of think back on the Beyond Nurse Residency podcast for the last year, what do you think your favorite episode was?
Yeah, so I had to go back and look at them. I enjoyed all of them, but I think the one that stuck out to me the most this year was the Nurse Leadership podcast with Rose Sherman. And I think that's because it related really closely with my capstone project I just graduated with my master's from the University of Iowa, and I really focused on the importance of nurse leaders, specifically those nurse managers that are working closely with new residents, new graduate nurses, specifically in a nurse residency program, and really what is their role when it comes to supporting those new grads. Because every once in a while we hear it's difficult. I mean, managers and leaders, they're busy. They have so many responsibilities. It can be hard to maybe know how to go about supporting those new grads, the little things that they can do. So I think with Rose's episode, she really touched on those key things. And I know she was a great resource when I was working on my capstone.
I was so excited to sit down with Rose Sherman. I've followed her work for a long time. I got to be a part of a educational series where she talked about her 2 books. I read her 2 books. I think I was like, you need to buy these, Amanda. This is right up your alley. She has so much expertise. And I think that was one of our really popular episodes for our listeners as well, because she acknowledges that leadership role is tough, but that you still do have a role. And I think sometimes when we're pulled in all these different directions, this is an easy thing to just think the residency program is going to take care of. So what were some of the bigger, I guess, takeaways or lessons learned from what Rose shared?
So I think just overall, I think Rose, she shared so many key strategies that leaders can use. And I love too how some of them might take a little bit more time, but some of them might take less time. So I think she talked about encouraging that growth mindset, which I know we do in our program and I think is huge. I know a lot of new grads will say, well, I feel like I know nothing, or I'm learning so much, I don't even remember what I'm learning. And I think that power of yet we talk a lot about, and I know Rose talked about it in that episode too, and just reminding those new guys that you don't know this yet, but continuing that growth mindset, making those opportunities, I think too, for the new grads to maybe practice those skills they're uncomfortable with, asking questions. I know when I was working on my capstone too, one of the key strategies was keeping an open door too. So I think just making yourself visible to the new grad. So maybe it isn't checking in on them every single shift, but just showing that you're visible, you're there if you need them, allowing them to come to you, and just having that comfortable relationship and that communication too can make such a difference. And I think too, she also talked a lot about identifying strengths, which again, we also do with the residents in the program. And I know personally, when I kind of took the strength survey too, it was a good thing. I think sometimes it's hard for us to maybe identify our own personal strengths. We talk a lot about we're hard on ourselves, that negativity is sometimes easier on ourselves than others. So I think taking that strength survey and helping those new grads to identify those strengths in themselves, and then also helping them apply those strengths as they transition to practice.
And again, I guess this is another great example. All of those things you mentioned don't just apply to new grads, right? Like we can use those strategies. And I think we do use those strategies even in our own team, or at least I hope we do. I think we talk a lot about what are your strengths and how do we help you use your strengths at work? Because that's where you're going to be most, I think, satisfied versus always trying to work on improving weaknesses or those opportunities. And I think growth mindset. I think Jill's a great example of this. Like, I don't know how to do a podcast. I've never done it before, but I'm willing to give it a shot and learn and figure that out.
I liked how Rose talked and highlighted the fact that it really does take a village to onboard a new grad. And I think that's not just specific to a new grad. I think that's any new individual coming into an organization. It should just be this welcoming and dare I say like loving culture that we're welcoming the new folks into.
And everybody plays a role in developing that new person, right? I think everybody has a unique job that they do within the organization. Sure, like the immediate supervisor could be responsible for, certain things, but I also think team members bring their own unique contributions and have their own unique way of connecting and making that individual feel kind of included in the culture and the organization. And so we just can't put all of our responsibility on just one individual or one key program or right. It kind of goes on.
And I think the strategies and even in Rose's books, the things that she shared yes, the manager and nurse leader should be doing those things, but just like you're all saying too, I think the preceptor or the educator, whoever is checking in with the resident, can implement those strategies as well.
Anything else on the nurse leader episode that you wanted to share?
One of the key takeaways too that I had was when she talked about being a nurse leader coach. So kind of coaching them along. I think there's kind of I've certainly worked with leaders that maybe have that coach aspect a little bit better than others. So that was another key takeaway that I had for sure.
Well, and I think as a leader, it gives leaders permission to not maybe have to have all the answers, right? So a lot of times when you think about a leader that's in charge of a new hire, that it's about me telling you exactly what you need to do and having all the answers. Whereas when we take more of a coaching perspective, it's about how do we help you kind of continue to fine tune your skills to figure out some of these things for yourself, kind of going back to that growth mindset aspect, and really just focused on developing you to be the nurse that you aspire to be. And yes, I want to keep you here and in this unit or in this organization, but we want to look at sort of the broader needs of the individual. All right, Jess, last but not least, why don't you, we haven't yet introduced you either, so why don't you introduce yourself and lead us into your favorite episode?
Sure. So I'm Jess, and I'm one of the program coordinators for the IONRP program. I grew up in Southern Maine, and I got my BSN from the University of Maine quite a number of years ago in 2006. And then in 2019, I completed my master's with a focus on nursing education. And then for those of you that are doing the math, that's 18 years that I've been a nurse, and I still love it every single day. There's challenges and successes, and I think it's a wonderful profession. For the first several years of my nursing career, I worked in a larger teaching hospital in Southern Maine. I then moved to Colorado, and I started working in a 56-bed community hospital in the mountains, where I was a clinical nurse educator for several years. And part of that role included teaching a preceptor program, onboarding new hires, and actually working with the transition of practice program. So a fun fact is I was an online site coordinator for the program before joining the IONRP team in 2022. I still staff clinically at that community hospital, so I get to support new grads around the country in my community still. And I also teach the nurse aid training program at our local community college. I think my favorite episode this past year, I enjoyed all of them, just like Amanda mentioned, for a lot of different reasons. But if I had to pick a favorite, I think episode 3, the role of the preceptor, was probably my favorite. And I think, Nicole, you started the episode with the line, first impressions aren't just important, they are everything. And to me, that's like the biggest takeaway of that entire episode. And I think something that we really should keep in mind. I'd be really curious to find a nurse who doesn't remember their preceptor, both as a new graduate and maybe as an experienced nurse changing roles or being trained to the charge nurse role or house supervisor, or however your career has sort of progressed, because that person is so much.
Well, I think it is. It's your first impression when you finally get through, all the HR, all the hospital-wide or organization-wide sort of information. It's then this is sort of your home. This is where you're landing, right? And that first impression can totally make or break your perception of the organization.
Yeah, and just like Rose Sherman mentioned, it really does take a village. So yes, you meet with HR, and then you do all of your onboarding and your interview, the entire process. But then coming to the unit, it is a completely different, it's another first impression. And I think it's so important to keep that in our mind.
Because this is where they're going to stay, right? So yes, the HR piece, right, is is also a big important piece. But, this is where I'm going to be coming to work day in and day out, and having good relationships with those people, especially the preceptor, and being treated, kindly and fairly and included, and feeling like I'm a part of the team, which are all those kind of first impressions that preceptors are really responsible for. I think sometimes we underestimate the impact of that person in that role. And we're really quick to just put any warm bodies in that position. And we just, if we can, take some time to really make sure we are choosing wisely.
Yeah, I agree. I think it's such a powerful role and sometimes not always given the credit it deserves. So I think choosing wisely, and a warm body is not always the best body.
Any other thoughts or takeaways?
I think Allison also talked about the importance of knowing your resources, knowing who you can talk to, who you can ask questions of. And that's also partially why this became my favorite. We don't know everything. I've been a nurse for a long time and I still ask a lot of questions. I still need to utilize resources such as policies and procedures. And then I think Amanda and I really try to reiterate this with our new grads in the program. So I think that is just a huge takeaway. Allison also talked about best practices for establishing a preceptor program. So if your organization or facility doesn't have anything in place, she talked about ways to mitigate preceptor burnout, which is a really real phenomenon occurring. I think all of it's so great.
I think I really love that episode too, Jess. And I think it kind of tied in closely with the episode that I picked too, with that leadership. And I remember Rose even talking about we should know the nurse grad and preceptor relationship. Do they kind of mesh well? Do we think this is going to be a good relationship? Are they going to communicate well? And I think as a leader, you're kind of a key role in figuring out that relationship. And you should know too, be checking in with not only the new grad, is it the preceptor and the new grad, is it going well, but also checking in with the preceptor too and getting that feedback, I think is important.
I think one really cool thing that I just noticed is how all the episodes do connect, and there's threads that are weaved through all of them that are similar. And I really found it neat that Rose talked about coaching. I know Allison talked a lot about coaching. And then I just thought back to our NPD week episode when we talked to the VA, Misty Brooks, and with her having such a solid residency program, they are looking at these new grads and they're recognizing leadership in some of them and seeing which grads could go on to be successful preceptors. So they're almost getting to pre-screen these new grads and say, wow, this was my best resident. I could see her being a preceptor. She's already gone onto the clinical ladder where she is going to be a preceptor. So I just thought that was neat that nurse residency can lead to creating really good preceptors too. And Amanda, you are kind of that way in your residency.
Yeah, I was going to say, I think that's a lot of the idea of this leader coaching, right? Is that part of that is recognizing what these strengths are and helping them figure out how they can then continue to use this and benefit themselves, help them grow as an individual, but also help the organization grow. And so we talk about that in preceptor. Rose talked about that. Some of our spotlights talked about that. And I think in the residency program, one of our sort of key topics is getting them thinking about what's next, because, back to that growth mindset, back to the power of yet, like we're never really truly done learning. We're lifelong learners. This is a part of us as a nursing profession. And the program speaks to that. And a lot of the, I think, Beyond Nurse Residency guests sort of spoke to that as well.
I also think it's important to recognize not all nurses want to be preceptors or would be a good preceptor. That doesn't make them a bad nurse. And I think helping leaders recognize that aspect of it is important too.
And it is a specific role with a specific set of competencies. And just because you know how to, do something doesn't mean you can teach other people how to do that same thing, right? And so, as we sort of begin thinking about 2025 and some of the guests or topics we would like to cover, I think diving into that a little bit more would be beneficial for our listeners. What is that role? What are those competencies? And how do we begin to sort of recognize and grow those in our preceptors? So that kind of leads in, though, nicely to our next question, which is about season 2. So we're at the end of 2024. I can't believe we've already done 12 episodes, or this is our 12th episode. I can't believe how well received I think the podcast was. I mean, Jill and I continue to sort of watch the numbers grow for the number of downloads. And it's really been amazing. I don't know, Jill, I was surprised. I was like, even if we have 2 listeners, I think I will be happy. But it's been so much more than that.
Yeah, we're like 15 downloads away from 500 downloads. So that's like a big milestone.
Yeah, I think that's going to be huge. What a great milestone. And I think, talking to people at conferences, people have told me how much they appreciated the podcast, that they look forward to the episodes. I actually had one person say, I print off every transcript and I highlight and I write notes and I do all of those things. So while we felt like this was a great way to sort of educate and connect with users of our program, it goes far beyond that. And there's a lot of people who have nothing to do with our program that are benefiting from this information, which I just think is amazing. But as we sort of finish out the end of the year, I always am planning for what's next. And so I would love to hear your guys' thoughts on maybe what should be in maybe the pipeline for 2025. So are there any specific guests or topics that you think we should maybe think about exploring?
Just looking back, I really enjoyed listening to like the NPD week episode where we talked to our facility site coordinators, and then our 10th anniversary episode, how it all began and where we're going. So just off the top of my head, I think it'd be interesting to talk to a past resident and talk to them about what the experience was like and what they're doing, just to kind of follow them on that path.
Yeah, I think that would be really interesting to do. And I think it would be really interesting for our listeners to kind of get an inside look at, not only obviously about our program and the benefits, but from a new grad's perspective, where do they see maybe the gaps between education and practice, and where are they feeling like they need additional support? Sure, how does this program sort of do that for them and help close those gaps? But, most importantly, I think just kind of doing a little bit of a needs assessment, if you will, for the world to sort of hear from that new grad, which is who we are focused on. So I love that idea.
That's right along the lines of sort of what I was thinking too, just continuing the discussion on outcome measures and that return on investment, because so often we see educational programs cut in times of financial hardships. So just how can we help our organizations demonstrate the importance of these programs, not only, of course, for the nurse residency program, but also for the organization, for patients.
That was one of our latest episodes, was on like ROI and building the case. And that was something, I specifically sort of asked Kathleen Opperman about, was, when we're faced with these sort of budget cuts and decisions, because we know education is always sort of the first one to go, how do we continue to make the case? And her, suggestions or recommendations were all about, collecting, that information. So yes, it is about retention, but it's also about so much more than that too. So thinking about the professional experiences and how the organization is benefiting from these things, looking at how that individual nurse is continuing to grow and develop, and sort of learning how to tell that story to those decision makers. And so, yeah, I mean, I think that was one we just hit, I think, the very beginning of the basic information around this topic, but something we can most definitely dive even more into. Another person I would love to have an ongoing conversation with, and we didn't mention her earlier, but Heidi Gilroy's episode on trauma-informed professional development. I think, Jill, correct me if I'm wrong, but outside of like the 10th anniversary episode, she's been our most listened to podcast episode. Is that correct?
Absolutely. Yep.
Yeah. And so her sort of fresh take on this idea of trauma-informed care and trauma-informed care being applied in the NPD setting, I think it is just such sort of a new concept for people, but an important concept. And it plays into this topic of well-being and resiliency. It plays into the leader coaching that we've talked about. And it most definitely even plays into the preceptor content. And so kind of going back to Jill's comment about how all these episodes sort of thread together, I think this is a great example of what that looks like and how those things all sort of, come together to move us beyond nurse residency, move us beyond just what's happening in this program curriculum, but to all these other factors that sort of come into play.
That was our most downloaded episode, actually. It's our number 1, and that's episode 2.
She's so passionate about that topic. I love listening to her talk about it. It was great.
Yeah, I actually have that written down as one of my takeaways from the last year too, because I couldn't decide because they're all so good. And I love one, I had never really heard of trauma-informed care. So I think even for me as a nurse, I had never really heard of the topic. So I think it was really informative. And I like too when she talked about the not only like physical safety at work, but that professional safety at work. And there's so many different aspects to it. That was a great episode.
Another idea for 2025 I thought of is we sort of touched upon it a little bit and the idea of accreditation, but maybe talking to an organization that has gone through that entire process and having them give a little bit more information about all of it. Because I know we touched upon it, and really accreditation is a gold standard and we want all our organizations to achieve it. So how can we help encourage and support them to get that gold standard? I think that could be interesting.
Yeah, I think it would definitely be interesting. I mean, we heard from Sherry Cosme, who is the director of PTAP accreditation. So hearing her perspective, but I love that idea of talking to somebody who's actually went through the process and what was that like, and what did they learn about nurse residency? Because I think that's one thing I hear a lot from people is I learned so much about residency and sort of where our gaps are and how we can improve by going through the process. So, I would love to get a take from somebody who has done that. And also, from various accrediting organizations. So PTAP is just one accrediting body. There are some others out there that some of our organizations are exploring. So I think that's a great idea. Any other thoughts on where we maybe should go in 2025 as we start putting together our list of guests?
I know one other topic that I had written down is kind of the idea of innovation. I think it's becoming kind of a hot topic in healthcare and nursing, but really, what is it? How do we use it? So I think maybe having an expert that maybe they're using it in their facility, or maybe they just are researching the idea of innovation. And I think too, how can the leaders use this in their nurse residency program? And how can we educate those new grads too on the idea of innovation? Because I do think it's going to continue to grow. So I think that would be an interesting maybe person to have on the podcast.
I love that. Innovation, is definitely something that I am very interested in, thinking about how we can use innovation as a team to continue to grow and expand our program. But I love that idea too of infusing it into the nurse residency program so that our new grads are sort of getting this from the get-go. Because much like Jess, I've been doing this for 18 plus years, and innovation is something that's just newly being talked about on year 18, right? So imagine if you had some of that information year 1. What do you think? I mean, maybe your career wouldn't look any differently, but maybe it would, So that's another great idea.
I think another important topic that's sort of front of mind with where I staff clinically, and I think just everything in the world, is health equity and social determinants of health. So I think it would be really interesting to hear from an expert on how we can integrate that a little bit more into our nurse residency program, maybe into our patient care, into the NPD realm. Both of those topics would be interesting. Social determinants of health looks a little bit different depending on where we are. Some of us are in very rural organizations and facilities, and some of us not so much. So that would be interesting.
Yeah, and I would add to that, and Rose actually is another one that brought this up in her episode, but this, how do even the social determinants of health impact new nurses and new employees in an organization? And what is the organization's role in supporting some of those areas? So I think she referred to it as social determinants of work health. So work doesn't necessarily cause them, but it plays a role, right? So I think in her example, she gave the example of how, new nurses coming in, the organization has them meet with a financial advisor because they know how important financial stability is in their ability to show up and do their work. And for a lot of new nurses, this is their first real life paycheck that they're getting, right? If they're a traditional college student, they're 22 years old, they're getting this money, they're setting up 401ks, they're doing all of these things. And from an employer standpoint, what is our role in helping them in these areas? And so I think looking at it both from a patient perspective and how we can help our nurses take care of our patients, but also how can we help our organizations take care of their employees? All right. Well, this has been a really fun episode to kind of think back. Whether we mentioned, I think, the guest or not, I have to say, every single episode I've done has been hugely beneficial. I mean, off the top of my head, somebody that we failed to mention, but Kathy Casey was our very first episode talking about new grad readiness. We had Katie Knox talking about simulation and bringing simulation into nurse residency programs. I think actually, other than those two, we've pretty much hit on every single episode that we have recorded here this year. So good things, I think, coming from every single episode. And so if you're new here, if this is the first episode that you're listening to, I highly recommend, maybe binging some of those episodes on a long car ride and starting all the way back at episode 1. I thought this was a really fun way to kick off our year-end review that we are in the midst of working on right now and begin making plans for 2025. So I'm really excited to kind of see where things go, not only with this podcast, but with the program. And so grateful for all of you and all the value that you bring to what we do. And I really look forward to the new year. Wait, before you go, I want to make sure you know all about our suite of resources you can use to support your new graduate nurses. This includes our Academy, a coaching program designed for organizations as they prepare for the implementation and ongoing sustainability of a nurse residency program. Work one-on-one with residency program experts to make sure your organization is residency ready. Our Clinician Wellbeing course is an asynchronous online course that aims to enhance the well-being and resiliency of healthcare professionals, equipping them with the necessary psychological capital to navigate challenges inside and outside of work. Supporting Nurses is another asynchronous online course for preceptors, mentors, and coaches to learn the skills they need to support any new hire. Both of these offerings can be used as a standalone professional development opportunity or to augment any nurse residency program. And we can't forget about the program that started it all, the online nurse residency program. This includes a comprehensive curriculum designed to support new graduate nurses applying all the knowledge they learned in school to their practice. We focus on professional skills, personal well-being competencies, and new graduate nurses even get the opportunity to create real change in their own organization. Offered completely online and in a blended format, this program is highly adaptable to all clinical practice settings. You can learn more about all of these programs and more of what we offer using the links in the show notes below.